So my name is Annie Sparrow. I'm an assistant professor at the ICANN School of Mount Sinai, and I also advise the Director General of the WHO. So I'm delighted to be here with two men, and I hope to be joined by my counterpart, Grace from Rwanda. But in lieu of that, we're going to improvise and go straight to David Edwards. David is the General Secretary of Education International. This is a organization which represents 32 million teachers and other school support staff around the world. Now, what we do know about COVID is that there is a very, very tiny, tiny risk of children actually dying of COVID. For example, in the States, in the last, through to September the 17th, there have been only 109 deaths. And whilst each and every death is a tragedy, that's out of what we are now talking about, nearly 200,000. And influenza, for example, causes at least twice that many. What we do know is that there is a much greater risk to children by being out of school, and that starts with learning losses, which are already severe. We are now looking at 90 million or nearly 90 million children being out of school, and more than 1.5 billion were out of school at the first peak in April. And it doesn't stop at learning losses. There are also social factors. The exposure to violence, to harm, to sexual abuse. We see greater teen pregnancies. We see early marriage in many areas. So there are a range of educational losses, social losses, economic losses, and it also, of course, impacts there's the effect on the actual parents who are at home, where most of those who are at home looking after children who can't go back to school are women, and this, of course, prevents women from re-entering the workforce. So what we are talking about really now is how to reopen schools, and bearing in mind very clearly that girls are primarily disadvantaged here, and they're the least likely to be able to return to school. So with that, I'd like to hand over to David to talk about some of the harms and how he sees the picture.
Thanks, Annie. And John, everyone, pleasure to be with you. I think it looks like Grace is joining us. Do you want to go to Grace? Or
Grace, are you here? And David, you may need to turn up a little bit. Turn your just to speak a little bit. Speaking to the holes.
I had the microphone down. Yeah, hi. No, I mean, it's a pleasure to be with you all. It's a very important topic, and in representing teachers, it's something that's absolutely on the forefront of all of our minds right now. It was about 1.5 billion children who suddenly were outside of school when the schools closed around the world back in March. Now, not all of those schools closed for all students. There were some countries that still had it, but there was this broad variation around the world in terms of who had access to online learning and who actually had nothing. So if you think about it, half the world's population has relatively no access to the internet. According to UNESCO, it's about 1/3 of kids that have no access to virtual learning at all. And so we spent the last 15, 20 years fighting really hard, focusing on girls, the UN Girls Education Initiative and others, trying to get more girls into school, because we're fighting against child marriage, we're fighting about child labor, all sorts of things like that. And it feels like in many ways the dial has just been turned back on us. We've been surveying our members around the world and talking to them about the impacts, the equity impacts of the school closures and COVID and other things. And there's a sort of a compassion fatigue that our members are reporting, whereas they just don't know. A lot of their students that can't connect, those who have the ability to connect, they're just saying the most marginalized, I just don't know where they are. The kids that we're most worried about in terms of going back into child labor, or maybe early marriage, or a parent that's lost their job, because we've seen the economic impact, and I'm sure this whole summer has been talking about that. And then you weigh these sort of costs and benefits, and we know that in terms of girls, the benefit of girls' education is huge, and sort of the social benefits, the economic benefits, and on and on and on and on. But for a parent, in a moment when they have to decide which child, where are we going to get income, someone loses a job, that's where we find the most marginalized. We find the girls. And the other stuff that we're finding out is about a lot of violence that's going on at home. Plan, Save, others have done a lot of research. We've been looking at this with them. The Malala Fund has done this as well, that's sort of corroborating our worst fears about what's actually happening to children, and especially girls, when they're out of school. And so part of the role, the struggle right now for us is how to bring everybody back, how to do it in the safest possible way that actually is informed by science and good practice, understanding that, you know, social distancing in some countries is easier than in other countries, understanding that hygiene and a lot of the different protections and the conditions around testing and the things that even the WHO, UNICEF, UNESCO put out as guidelines, you know, those are nice, but in some ways they become very abstract if you don't have the people on the front lines, you know, really engaged. And one of the things that I just sort of end with that we see is, you know, many teachers find out about the fact they're going back to school or what the back to school plans are when they read about it in the newspaper or they hear about it in the news. There's been a real dearth of information and dialogue, and I think that's one of the main issues. Now, also around the world, the teaching profession is a feminized profession, particularly in the lower grades, and in some countries, not going to school and teach means, like in Honduras and some Central America, you're not getting paid. So there's a lot. There's sort of a compounded issues on this. And you know, we're 100% trying to figure out the best way to get all kids back in school and learning. And the fact is that the online distance experience, the disruption that I think many had thought was going to be a positive, has been just a fantastic failure, both in terms of the kids that have lost access to that sort of socio-emotional learning, the health benefits, what will hope probably be vaccine access, what will be all sorts of other things. So the closure of schools as sort of the center of communities has just really detrimental effects on the most marginalized, and particularly on rural girls in the poorest countries.
I think you're on mute, Annie.
I'd like to try and bring Grace in on my phone from Rwanda and see if she can speak to some of the things that she can articulate very well to then balance what David said. Grace, can I put you on? Just start to talk.
Yes. Hi, I'm Grace Gatera, and I'm a lived experience mental health advocate. Can you hear me?
Yes.
Yeah.
Yeah. I'm a lived experience mental health advocate living in Kigali, Rwanda, but I've lived in Uganda. I lived in Uganda for 24 years, so I consider myself a native of both countries. I think the reason that we're here is to talk about how education is important, especially at this time. And coming from both countries, I've seen just how much damage COVID has done to the people around me, to my own family, and to kids who only have school as a resort to their life circumstances. So I think three of the biggest learnings that I've gotten in this time is that young people see, the same way that, women in my, countries see, social settings as marketplaces or places where they can get together and do business. Or shop together. It's the same way that children see schools. Schools are not just a place for education for my fellow countrymen. It's a space for learning. It's a safe space from difficult circumstances at home, including poverty and sexual abuse and gender-based violence and violence against young people. But also it's a way for them to get things that they don't get at home. So things like food and things like healthcare. I know that in some parts of, I know that in some parts of my country that we had piloted, an education school health program where kids got testing for malaria and they got testing for, hepatitis, and so kids were able to go to school, and it significantly reduced the number of dropouts. I know also that some NGOs like Action Aid Uganda has started a safe house for girls where they could get sanitary products, and this had greatly increased girls' motivation to come to school because they didn't have to go home all the way or stay away for a week as they have their regular period. And so, yeah, so these places, these schools are such an important aspect for the kids, but also for women who have the unfair burden of taking care of kids who have the largest portion of unpaid care work in our societies. And so they were able to go to the markets and they were able to do other things because they knew that they were in school. And also, there's a bit of an impact in terms of mental health when you don't get to see your peers for a whole year. When your life is destabilized, I think it's quite natural that your mental health also suffers. So I guess my biggest call to action would be that there should be serious moves made by policymakers and people in power to not only fund women and fund people at risk, but also to start moving, to start making decisions right now that will take kids back to school, to start making it safe, to start implementing all the policies, because we cannot wait around for a vaccine. People are literally depending on schools to open. People need to go back to school. So yeah, that's my speech. Thank you.
Thank you. And can you see already that there are the impact on girls, that they are not going to be coming back after this long? I mean, we're already September and schools haven't reopened in Rwanda or in Kenya or in so many places across Africa. So, for many girls, we're really writing off a big part of their lives, considering that education is such a critical, to complete high school or to complete school at all. It really puts you in a different position. So I'm wondering if you're seeing already the early marriage and the dropouts and the effect in your community.
I would say yes, that there's, especially for girls in rural areas. I think you saw the news maybe a month or 2 months ago, where they said that the quarantine period where countries were in lockdown, especially Uganda and Kenya, that there was a huge outburst of teenage pregnancies. What they're not saying is that that means that sexual abuse happened. That means that girls were forcibly detracted from school, and now they have to start these new lives with babies that their age, people they cannot handle to take care of. And so I think that while I do not have the accurate numbers, I think that for girls in rural areas where it was already hard in the best of times to convince parents to take them to schools, or that they're not just made for marriage, I think it has made going to be impossible now for them to be convinced. They're like, oh, they stayed home for 9 months. Yeah. What's another lifetime? Sure. Or what are they good for?
Yes.
Yeah.
And that's you've said it really. I mean, no one is coming to save us. I think that's clear. So we really do have to save ourselves. And with that, I think over to you, John. I mean, how do you see this loss, this huge loss of human capital of women in the workplace? And because how can you ever then recall those women, or you can't? But how are you going to address this problem?
Oh, look, thanks very much, Annie. And I must say,
I got to introduce John is the Secretary General of the International Chamber of Commerce, which probably may have to do a better job of introducing yourself.
We're the largest business organization. We are the institutional voice of 45 million businesses globally. We're actively involved in the battle on COVID, but also the whole issue of lives and livelihoods. But I don't want to reduce my comments to a series of throwaway remarks. I was really taken by David's opening comments. I was really taken by Annie's opening comments, and also by some of the observations that David made, and obviously Grace as well. The way we look at it is that we can understand, particularly with COVID in the first quarter, when so little was really known about the disease, that a lot of precautionary interventions by governments and policymakers were really designed because there was genuinely an abject concern, complete concern about loss of life. As a consequence, we can understand why there was closed down this, closed down that, etc. But we know more now, and we also know that we've seen this in other areas of grappling with COVID, that a number of the decisions that were made in the early days were actually not particularly well informed. And we know that because they were not actually fully informed and they were just precautionary, which is, as I said, understandable. But clearly the whole framework and decision-making has to change. We've seen that in the economic cycle, we're seeing that in the human and social cycle as well. And we're obviously seeing that in the health cycle as well. The big bit that I noticed from David's comments, and this is, by the way, this is something that's happened in other areas of global decision-making. It's like people were happy because they're able to sort of say, well, actually everyone's going online. But I think as David has so eloquently pointed out, that kind of breezy, it's all going to be okay, everyone's online, let's find a positive out of this, is actual nonsense. What you've actually seen, and then David gave the figures in a gruesomely telling manner, the number of people who are unable to access online learning, but also a failure to understand that the actual essence of the public education system, a bit like public health, it's actually a social vaccine in itself. The actual bricks and mortar attendance at school is actually critical to children's well-being and the capacity of children to learn. But importantly, in terms of the social lubrication, the ability of parents to work. And I think we already know, and Annie, you would know the numbers better than I about healthcare workers, the number of those, obviously the vast majority of women, of those, the percentages of like 10 or 15% of the global health workers have actually been unable to do their job because they've actually been unable to allow their kids to go back to school. And we've still got massive close downs, I think still in 50 economies, we've still got complete close downs of school systems. And as Grace has said so eloquently as well, I mean, the reality is people had not fully understood the social consequences, but even that little bit of Q&A from Annie with Grace, maybe I'll put it in a little bit more, I suppose, stark terms. The skills degradation or the skills loss we're seeing even through this period will actually be significant if actually looked at in a full economic cycle. The fact that children are not learning, not building their skills, not building their capabilities, some will not go back to school, that is actually a loss of human capital. And there are some numbers running around that on a relatively benign piece of work done by the OECD, we're already seeing more than $1 trillion worth of lost human capital just from the failure to open schools again. And so from our perspective, and this is not dissimilar to other elements of the challenge we have with COVID, in the absence of the silver bullet or the gold bullet, which is the vaccine, and even then, what will the vaccine be? How long will it last? You know, there's all sorts of questions we don't know the answer to. I mean, this is not the influenza. I mean, Annie's the expert, but I think I've been around now a number of these huge discussions with Dr. Tedros and others to realize that this is a lot more complex than people think it will be. The thing that we still need to do is function. And then that goes from risk avoidance to risk management. But also part of this is actually how do you build trust back? Because if you want people to go send their kids back to school, you have to build trust and confidence. How do you build trust and confidence when you don't have a vaccine? You don't have clear information. Clearly, you've got to have tools and implementation which can actually support that. It's not just by saying nice things. And you do have to look at the nature of testing. You really have to look at the nature of testing, the speed with which testing, how do you give people confidence? And even though we know, I mean, I don't want to say it because maybe, as I understand it, the challenge for children is actually not being infected by COVID-19. It's actually other issues that go on. But the challenge for parents is the confidence of bringing the kids back into school. So how do we ensure there's appropriate testing? How do we build that trust again so that we can actually start enabling kids to go back to school and stop this kind of breezy dismissal? It's all okay, we've all gone online. Well, we haven't all gone online, and even going online is not going to resolve these issues that Grace has described to us as well. And going online is not going to fix up this macroeconomic shock we've had in terms of the skills degradation and a loss of human capital. So we do have to think about building trust, and a lot of that goes to practical, fundamental things like how do you ensure that you have a trusted identifier of when someone has been tested, appropriate testing, speed of testing, and access to testing on a global basis, which is why more governments need to get involved in that kind of discussion, and there needs to be more global cooperation to work our way through it. You're back on mute, Annie. It's very unlikely to be on mute.
I think we really did hit it there with the trust issue. We have a global shortage of trust, per se, and I think that's really critical for women, because it's really the women and the businesswomen here, where part of our audience, absolutely critical here, I think, because at the end of the day, we are the ones who decide when our kids go back to school, when we have the confidence. And this is the thing, like, the kids, we can clearly see, they are going to get infected. This disease is endemic. It's here to stay. We're not going to get rid of it. So we need to know how to manage it. And the risk will never be zero. We'll have to balance that. But the risk of harm to the children is one thing. The risk for the teachers, of course, is another. And what we're seeing is that, this is, of course, David can speak to this, but it's a vocational area. They're not going to stop teaching. And I understand, that, there have been hundreds, several hundreds of teachers that have died, in the US alone. And, also just 2 more this week that dying, in terms of like right in front of the class, and we're not talking about, extremely vulnerable teachers with comorbidities, but yeah. It's really that how do we make it safe for the teachers? Because as Grace has said, it's like, I think we can get behind children as our common good, and we can see how valuable education is as the single most important determinant of health and wealth, but it's getting the kids back to the physical schools that is going to reopen our societies and reactivate our people like myself. I can't go back to work either until when the schools shut down. But so I'd like to ask David, how you feel that can happen too, because we've got just maybe 3 minutes left. When John's talking about testing, it's just because the child tests positive, we don't, they don't need to go home. The child they are at least only half as likely to infect other people. We do know that they very, very, very rarely infect teachers, and teachers slightly more commonly infect them. But the schools per se are not generators of transmission. But in this sort of blunt way, we'll lock down the whole of society. Now we have to sort of reopen up with surgical precision, and it becomes a lot harder. But certainly we do know that schools can and will be safe places again, but we need to make them safe for the teachers. And that also means the commute in general. And maybe it also means more broadly, we're going to have to sacrifice our pubs if we want to open up our schools. But I think that we could do that. I'd like to then hand over to David to think, how would you then, how do you then visualize it, making it safer for the teachers?
Yeah, thanks, Annie. And I really appreciate what John was saying in terms of the sort of public health and public education as sort of the vaccines of society too, and recognizing that, and recognizing that infrastructure and that investment in those systems is what makes it enables business to take place, and for human capital to flourish, and for people to live really great lives. And I think we take the custodial responsibility seriously. We understand that custodial responsibility as teachers. But more than that, we've seen is like you said, we've had teachers that have been on Zoom calls, one in Argentina and one in the US just in the past 2 weeks, who have actually died in front of their students. One was in the hospital bed teaching, and one was actually on her 4th week of recovery. And the fact of the matter is, we need much better institutionalized dialogue between employers and between workers, between teachers, their organizations, and governments. We need to build that trust there, so that the trust also builds in terms of the communities and also with those students. So I think that's absolutely important. One of the things that we're going to do is EI, and Annie's going to participate, and Dr. Tedros, and hopefully many people here will just, it's 5oct.org, where it's World Teachers Day on the 5th of October. And usually we kind of mobilize and have this sort of big appreciation of teachers around the world. But this time we've decided that what we're going to do is a 24-hour broadcast in all the regions of the world, with world leaders, heads of organizations, cultural figures, and teachers themselves talking about what they've learned during the pandemic, what the world needs to know, and what we need to do next. So I wanted to just put that and invite everyone to be part of that conversation, because I think there you will also hear us and our allies and everyone talking about the need to open up safely and respectfully and in a way that actually builds that trust instead of scapegoating and trying to point the finger and win short-term political gains, which I also think is something that's happening out here. Maybe is why they care more about the pubs than the schools. But you know, I think there's a real opportunity for business leaders to stand up and say, we want schools to open, we want the most marginalized to get the supports, the wraparound services, we want teachers to be listened to, and we're going to put our political weight behind it, make sure leaders deliver on that.
And I encourage everyone to tune into that. Women are clearly, you know, have critical roles and critical voices as part of both the economy and as entrepreneurs and as mothers. And this is a very rich topic that is not over. And I would look forward to continuing it with both of you. I think we have to get off in like 30 seconds ago, but can I just hand over to John for 30 seconds of goodbye?
Thanks very much. It's great to be on this conversation. If there's a choice to be made between pubs and schools, you've got me for schools. And we would generally like to participate in some form of recognition of teachers on a global basis on the 5th of October. So if we can talk about that.
Great, thank you so much, both of you. I'm so sorry that Grace wasn't able to be a whole part of that, but I'm glad we were able to listen. And I thank you all in the audience for, as I said, it's a very rich topic. We've only just begun to explore it. And as David and I pointed out a while ago, we need to hear from the kids themselves and from the youths. And that's going to be pivotal in moving it forward. Thank you, everyone.
Thanks, Annie.
Thanks, Annie.